So as you look at the various ways that we pay for the care that we're going to deliver in your virtual skilled nursing facility, think about how your process of financing, organizing, managing, budgeting is going to help. And with that goes your electronic medical records. This is when we're going to start talking about that, and the minimum data set. These are things that if you do not document, you did not do it. It's the bottom line. Your nurse says she delivered a medication to John at 10 o'clock, but it's not written down. She may have delivered it, but it's not written down, therefore it did not happen. If it did not happen, it cannot be coded. If it can't be coded, it can't be billed for, and if it can't be billed for, it cannot be reimbursed. So everything you do, did you have your fire drill this month or quarterly, depending on what state you're in? If you didn't do it, then the state can take that Medicaid dollar away from you because you did not keep up with safety regulations. So it's very tempting to say, I'm never going to have to deal with that because I'm going to be a administrator, or I am going to be a nurse or a physical therapist or this or that. It doesn't make any difference. Every cog, every wheel has a piece of how the system runs. So if you don't take credit for that IV, if you don't put down that procedure of doing activities of daily living with your clients, or the social activity that you paid for them to go to, say, the zoo, down, you can't bill for it, and you can't get reimbursed for it. So you have to document. So you'll be looking at documentation and coding and reimbursement in this next 2 weeks as well. And there is rationale for every single piece of it. So when your virtual employees say, I don't like paperwork, tell them tough, because unless they do the paperwork, there is no proof that they have delivered the good quality and compassionate care that they said they do. So documentation is vital. Can I say that again? Vital to your sustaining a skilled nursing facility, because it's only through coding, billing, and reimbursement that the cycles back to paying your employees well, teaching them well, maintaining their skills, improving their skills so they can deliver it to the patient, the resident, the client who is receiving that care, hopefully with a cheerful face, skilled hands, and compassion. That's it for this week. Go out and learn well.